So, good morning, everyone here. Thank you for coming to University of Miami. I'm going to introduce our first plenary speaker for this morning. I borrow 2 minutes from the Webb to introduce she here because I know everyone wants to see her and thanks for her work. We can have this event, and I really want to appreciate my gratitude to her. She has done a lot for putting everything together so we can have this moment. And that's really a big pity for us. Like she's not able to be here today. She asked me to express her gratitude to everyone. She's a PhD student who received her PhD in 2014. So she's now an associate professor in the University of Miami. And so, yeah, thank you. I will definitely, I know I received a lot of messages from you. I will bring those messages to her. And so we found a lot of things we can improve next time. Or hopefully we have next time. I'm very happy. I hope I can bring everyone back to University of Miami to celebrate Shigui's next birthday, probably. Or probably Chris or probably Steve's birthday. So back to our plan of speaker today. So Dr. Webb, many people start from your book, the theory of nonlinear age-dependent population dynamics, which published in 1985, which was before I was born. And the cover is half red, half white, he has made a seminal contribution to the nonlinear population problems. Besides that, he has also made a lot of great works in the mathematical biology and mathematics and epidemiology. This is Shigui last year in Vanderbilt University who gave a plenary talk to celebrate Glenn's 80th birthday. So it's our big honor to have them back here to celebrate Shigui's birthday.
Here we go. Good morning, everyone. Can you hear me okay? First of all, I want to again say happy birthday to Shigui. I won't sing it this time, but I do want to say happy birthday again. And I want to give my greetings to Shui Guo, who unfortunately is not with us here, but I wish her the very best. And I thank you all for coming this morning, getting up to come to this talk. I will talk about COVID. And you think about all the things that have affected our lives, many things, but COVID is the most important, I think. It's given more effect to what we have in our world than anything else. I stayed home for more than a year and taught virtually through Zoom, and I'm sure many of you did too. So all the things, all the events that have happened, okay, sorry. Okay. COVID has the most effect. And I think mathematics and those of us who are interested in mathematical models of epidemics can contribute to the understanding of what happens with COVID. And we can try to prepare for the next pandemic. 100 years ago, there was a pandemic, the Great Swine Flu. And it was worse than COVID. It also killed about 1 million American people, but they were young people at that time. That epidemic had a greater effect on young people. So, and the population was half of what we have now. But again, we could have a pandemic. It may be another 100 years, or it might be next year. You just don't know. But I think we, as mathematicians, as mathematical biologists, we can contribute to the understanding of what happened with the previous episodes of pandemics, and we can try to prepare for the next one. Okay, so this is showing work with Evelyn Sal. I don't know if she's here somewhere. There she is, and she's now at the University of Tennessee. And she's doing very well in the world of mathematical biology, by the way. And so this is our subject, population models of epidemics with infection age and vaccination age. So the infection age model goes back almost 100 years, Kermack and McKendrick. And I think that was 1927. And so that was an amazing contribution to the subject. And infection age is very important. And the reason is that the moment you get infected with a disease, you're not instantaneously infectious typically. It takes time for the infection capacity to develop, and it rises typically, and then it plateaus perhaps, then it falls. And so this can be modeled by infection age, which I'll call A sub I for infection. So we want to model the infected people according to their infection age. And one reason that's very important is that when you become infected and you start your infection age, you're not immediately infected. You're also not immediately you're not immediately showing symptoms. You're not immediately symptomatic. And there can be a period of time which we call the pre-symptomatic period, when you're not symptomatic, but you are infectious. And this was true with COVID. I'll talk about this later, but it was approximately 2 days. There were 2 days when you were not symptomatic, but you were infectious. And that was a big problem, because you could be sitting in an auditorium, sitting next to someone who is not showing any symptoms of any kind, but they are infectious. And they don't know it, and you don't know it. And that's one of the main reasons that evidently COVID-19 is such a terrible pandemic, that period of pre-symptomatic infectiousness. There was another epidemic about 20 years ago called SARS. And SARS, when it first broke out, there was a huge concern that SARS would be like the swine flu or the current COVID-19 epidemic, because it had such terrible consequences for people who were infected, very high mortality. But SARS kind of fizzled away. And why? Because when you were infected with SARS, you were not infectious until you were symptomatic. They were coincident. And when you were symptomatic, you had terrible symptoms all of a sudden. But it was known, of course, that you were rushed to a hospital. And in places like Taiwan and Michigan, many places, SARS just fizzled out quite soon. So it was not a terrible pandemic. And that was one of the reasons, because you could identify the cases of infectiousness. So we will have infection age, and we'll have vaccination age. And vaccination is also another story that you can track with age of vaccination. So the moment you get your vaccine shot in the arm, say, that starts your vaccination age clock running. It starts going forward. I'll call that A sub B, lowercase a sub B. And that's important because you're not instantaneously immune from infection the moment you're vaccinated. It takes some time for the effectiveness to build up, and it typically plateaus, and then it moderates, it decreases, and goes away. So that's another story that you can track with what we call structured variables. So these are differential equations models with structured variables. One will be age of infection, one will be age of vaccination. So this is what I've been talking about, so I won't have to say much more here. But again, we have vaccination age, we have infection age, and we're particularly interested in this pre-symptomatic infectiousness time, which we can track with age of infection. So here it is. We have for COVID, we have the values we'll call R from age vaccination, sorry, from infection age 0 to infection age R. A sub I goes from 0 to R. You're not infectious. We call that sometimes the exposed period. So you're infected, but you're not yet you're in the exposed period. Okay. And then we have the infectious period from age A sub I equal to R to age A sub I equal to R plus S. So after R plus S, your infectiousness is eliminated. You're no longer infectious to other people. Okay, so we designed the typical classes. We have capital E sub T of the exposed class, we call them. And E sub T goes from age 0 there to infection age 0, infection age. There we go. The infection age A sub I goes from 0 to R of the infection density lowercase I, function of A sub I in time t. And the infectious population goes from age R to R plus S of the density I of A sub I and T. We call that capital I of T, exposed, infectious, and then we have the removed individuals who have infection age greater than R plus S, but once they get infection age R plus S, they're no longer infectious. So we have these typical classes, E sub T, I sub T, and R sub T. But we model these with the structure variable densities, in particular here, A sub I. So age of vaccination, and again, I talked about that earlier. So we have A sub V, and your clock starts running on your vaccination age the moment you get vaccinated, and it goes forward, and typically increases, reaches a maximum, and then decreases. And so we have the vaccinated population at time t of individuals with vaccination age A sub B at time t, the integral from 0 to t of that. And that's a mistake right there. I should say that vaccination begins at time t greater than or equal to 0, not equal to time 0, but greater than or equal to 0. Okay, so we want to design our equations around these considerations. We have parameters. We have the transmission parameter, which we call alpha, and the rate of transmission depends on infection age. So alpha depends on A sub I. And then we have the rate of vaccination. That's a nu, Greek letter nu. And I take that to be a constant here, but it's not really a constant. But for simplicity here, I take it to be a constant. And then we have the effectiveness of vaccination. That's the parameter sigma of A sub B. It's a function of age of vaccination. And then we have the parameter beta sub H of AI. And that's the isolation. If someone is infected with vaccination age A sub I, and they're isolated, if they're known to be infected, we call that beta sub H. And then we have the quarantine rate of infection, the quarantine rate, beta sub Q of AI. And so if your infection age is A sub I and you're quarantined, we have a rate that occurs. And now we only quarantine people we do not know for sure are infected. If you know someone's infected, you don't quarantine them. You send them to the hospital or you isolate them in some way that they're no longer going to create cases. But quarantine is reserved for people who you're not sure if they're infected or not. So that's the beta sub Q, also a function infection age A sub I. So compartments of the model. So we have the susceptible class, that's capital S of T. And they can be vaccinated and removed from the susceptible class, and they go to the capital D of T class, the vaccinated class. They can be infected and go to the exposed class, capital E of T. And the vaccinated people can also return to the exposed class. They may be infected and then they go back to the exposed class, even though they're vaccinated, because vaccination is not perfect, does not always, but always keep someone immune. And the exposed individuals, of course, go to the infectious class, capital I of T. In both classes, they can be removed. And then quarantined individuals arise from the exposed class or the infectious class, and also arise from the infectious class, the capital I of T. So we have these compartments of the model. And here are the equations of the model. So this is typical of the structured variables model. So structured variables are very important in many applications, particularly in mathematical biology. So we have the class of susceptible individuals, capital S of T, and it changes because people who are susceptible become infected. And they become infected at a rate that depends on the transmission rate of infected individuals. So it depends on this interval from R to R plus S of the individuals with infection age A sub I between R and R plus S at a rate alpha A sub I times the density I A sub I T. And so susceptibles get infected, they also get vaccinated and removed, and that's at this constant rate nu with this mass action effect of the product of those variables. And then there's the typical structured variable equation, a partial differential equation, first order, and the two variables, A sub I and T, and we take the partial, the infection age density I with respect to T, right there on the left there of that equation. And we have the partial with respect to H sub I of the infection age density. And that's equal to this beta H A sub I, that's the individuals who are isolated or infected, and the plus beta sub Q, those are individuals quarantined who are infected, times the density I A I sub T. So this is typical structured variable equation, which you have to solve with various methods, typically method of characteristics. And then we have the initial moment of infection at infection age A sub I equal to 0. I don't know why this won't work, so I can't point to it. There's this equation on the left. We have I 0 comma T, and that's the individuals who are newly infected. And that comes from this top equation, plus this additional term of vaccinated individuals with vaccination age A sub I. So the vaccination age A sub B who are returning to the infected class, even though they're vaccinated. And then we have the equation for the A sub B density, and it's the partial of B with respect to T plus the partial of B with respect to vaccination age A sub B equal to this loss rate. They return back to the infected class, and so that equation accounts for the dynamics of the vaccinated individuals. And then we have our rate at which individuals start their vaccination age at vaccination age 0 times T is equal to nu times S of T from that top equation. So these equations are typical of a structured variable model. And so we have some expressions here we can interpret from the solutions of the vaccination and infection age model. The equation for the exposed class, capital E sub T, is individuals who are newly infected with infection age 0, and then they exit that class when they reach infection age R, from the exposed class to the infectious class. And then they're removed also because of these terms involving the beta Q, the beta H. And then we have the equation for I capital I prime of T is equal to the individuals who are infected reach infection age R. And they're removed at infection age R plus S because there's no longer infections at that maximum infection age. And they also can be removed due to the terms beta sub H and beta sub Q. We have the H of T and Q of T terms. They're obvious what they are here. And we have the R of T terms, that's the removed individual. So we get these values from the earlier model. Now the number of susceptibles is S0 at time 0. The number of infected individuals with infection age A sub I at time 0 is given as I sub 0 AI, and the number of vaccinated at with vaccination age AB at time 0 is equal to a given B sub 0 of AB. So these are the elements of this model. You have a pointer that works. I think it's just the work on the screen.
It's actually the screen obliterates the.
Okay. I'll point. And so that's the model. How do you handle this model? Well, you have to try to understand the theoretical properties of this model. And you convert the model using the method of characteristics and develop existence theory. And so these ideas are well known for such equations. And we developed this theorem, assume that for 0 less or equal to infection H, A sub I, less or equal to R plus S, beta sub H and beta sub Q, each a function of infection H, A sub I, is strictly positive. It's greater or equal to the value of beta upper bar, which is strictly positive. And assume a similar condition on the transmission coefficient function of infection H, A sub I, alpha A sub I is less or equal to a value alpha bar, which is positive, upper bar, and sigma, the vaccine effectiveness parameter, sigma function of A sub, I guess that should be A sub B, not A sub I, is less or equal to sigma bar, which is positive. And with those simple conditions on the parameters, we can establish the following theorem. If nu is positive, meaning we do have vaccinated people, then S infinity is 0. That's the limit as T goes to infinity of S of T. And if nu is 0, there's no vaccination, then S infinity satisfies this equation. S infinity is equal to the exponential of minus gamma plus S of 0 minus S infinity times lambda times S of 0. And gamma is down here, second from the bottom, and lambda is here at the bottom. So we have this complete understanding of the behavioral solutions of this model in the two cases: vaccination present, no vaccination present. So it takes some detail, it takes some work to do that, but we can prove that theorem. Okay, so as I mentioned, if vaccination is not there, nu is 0, then that's the current application, almost 100 years old. And the S, if you take that to the standard SIR model, SIER model, then you have these ordinary differential equations, and the behavior of those ordinary differential equations is given here. See, so that's an amazing result. Exactly. If you think about the important results in science, I would say Newton's laws are important, right? And I think this is the most important result in science. Why? Because it explains why you're here, why you are here this morning. Why are you here? Human history goes back 100,000 years easily, not 100 OE, and you take a person born 100,000 years ago and put them right there, and you wouldn't see any difference. How many epidemics have come along in that 100,000 years? More than a few, right? Thousands and thousands. And how many of them have wiped out the human species? None. Because we're here, we know. We can be sure of that. And so why? Because this model explains it in a certain sense. Epidemics go away. E of t goes to 0, I of t goes to 0, S of t goes to S infinity, which is positive. And S infinity satisfies this equation we know. So it's to me, it's the most amazing result in science. It's not known very well, but it explains, as I said, why we are here today. Because that's an important question. It's an important question. And this model, in a certain sense, explains it. Okay, so here are you take this ODE SEIR model, and you graph the solutions, and as we saw, the limit is t goes to infinity, S of t is S infinity. That S infinity depends on the initial conditions, depends on S of 0 and I of 0. And so we see it here, depends on where you start. All those black dots represent the starting value, but they all converge to this axis with the Z0. But the limiting value S infinity lies on this axis to the right, and it depends on where you start. So that's an interesting result. It's not a result that students see in the first course of ordinary differential equations, because usually you go through unique limits. But this one, the limiting value depends on the starting point. Depends on Okay, so we want to apply this to COVID-19, and my application is to New York State. And I chose New York State because it has very good data. It has very good data from the New York State Department of Health. Also, there's other sources of data for New York State. But what is this? This is the vaccination data for New York State. And vaccination started in 2021. And you see the daily, this is some kind of averaging going on here to get the rate of vaccination. So it jumped around somewhat, but this is the data. This is actually from CDC. And you see that the blue top graph is the average daily people vaccinated. And so that's our information about vaccination for New York State for COVID-19. And this is the cases data, again from the New York State Department of Health. And we see that this graph is a challenge because it's so up and down. We want to try to understand this behavior. And so typically with the epidemic model, especially the older ones, you set the parameters once and for all, and they just go on forever. But here we have to change parameters. We see different behaviors here. We see an initial peak, we see a plateau that's quite low, then another rise and lowers again, then we see the top peak at far right there. So we have quite a change going on in the epidemic output, and we have to try to model this, and we do so with a change in parameters. So we define phases. So this is for the transmission function alpha, which is a function of infection age, A sub I. For New York State, we have 7 phases. So alpha A sub I depends on the time value t. And it's constant for t in 7 different cases, 7 different phases. And they're broken down here. And some reasons given, try to understand why these phases had a change. For example, the one that phase 6 is due to an increase due to a new variant, an Omicron variant that arose in approximately November of 2021, lasted about 1 month. So we have these changes in the data that correspond to the phases that we identified for the model, for the data. Okay, so let's see what goes on here. We want to assign, remember we have these values R and S. So 0 to R, your 0 to R was the first time of age of infection.
age, infection age, A sub I goes from 0 to I. And that's the period before you're infectious. You distinguish infected and infectious. You're infected, but you're not yet infectious till your infection age is 3. And then you're infectious for a period of 11 days. That's the S value. And then 14, R plus S is the maximum age of infection. And after that, there's no longer infectious. Now, Q equal to 5 is the infection age for onset of symptoms. I haven't talked about that yet, but symptoms arrive when the infection age, A sub I, is 5. And so that means you're 2 days when you're infectious, but not yet symptomatic, the pre-symptomatic infectious period. And so that's very important data, because that's one of the main reasons that COVID was such a terrible. It's that 2 day window, that 2 day period when you were infectious, but not yet symptomatic. And so that's something that we want to track in our models of epidemics. As I said, for SARS 20 years ago, that value was 0. We were coincidentally infectious and symptomatic. So anyone's infectious was identified and removed immediately from the population. But not true for COVID-19. Okay, so here's the transmission function alpha of infection age A sub I as a function of T. Remember, we had this, I think it was 7 phases, and there they are in this graph. And this is the vaccination rate as a function of time. So for COVID, our model starts at day 0, but vaccination doesn't start later, so approximately 80 days, I think. And then the vaccination rate increased for time. And then this peaked and came back down. And we take this graph as the function of B of T. Now, this is the vaccination effectiveness. And so the moment you're vaccinated, you're not immune at all. But I have this flipped. If you take 1 minus this value to be the effectiveness, because the moment you're vaccinated, your effectiveness is 0. I chose it this way for some reason. And then it rises after a few days, it rises and peaks, and you remain immune to infection, at least partially, at a maximum for a time, for about almost 200 days, and then it declines, it goes back to 0 over time. So this is the value of sigma of T. And this is the hospitalization, or this removal of infected individuals due to isolation. You know they're infected, and you remove them. It starts at day 5, and symptoms appear. And then it removes individuals at this rate. And then the quarantine rate is graphed here. And so these are individuals that are quarantined, but you don't know they're infected. Well, you don't know they're infectious. And so they are removed, quarantined at this rate until day 5. Day 5, we know they are infected because they're showing symptoms, and you no longer quarantine people who are showing symptoms. And this is initial infection age distribution. And this is from some data, I don't remember right now where, but that's I sub 0. That's A sub I of 0. And then this is the model output. So there's a yellow graph here. If you look carefully, you can see a yellow-orange graph. And that's the model output of that model with all the parameters that I put into it. And then the red dots are the data. And then the blue graph is, the blue vertical lines, or the blue vertical lines attached to all those red dots. And we see that the model gives a fairly good report of the data. They don't our various phases are 7 phases. So the 7 phases are the vertical lines. So this is the model output, and it's a good fit to the data for New York State. And this is the vaccination. We have the vaccinated individuals from the model, and from data we have the red graph is the data, and the red graph is the model of the vaccinated rate, and the dots are the data, again, from New York State Department of Health. Okay, so this is the model output and the data concerning cumulative vaccination. So again, the model output of the vaccinated individuals gives a good match to the data, which is the blue dots that format the blue graph, and the red graph is the model output, and this is cumulative vaccinated. So again, we have a good fit. Okay, so let me summarize. We have developed a model of an epidemic structured by infection age and vaccination age. And so it's a way to incorporate many important features of an epidemic into a mathematical model. And so I want to say that I want to go beyond this. I want to introduce chronological age. Because chronological age is very important as well. For COVID-19, the disease was much worse for older individuals. And so we'll have a further structure there. A sub C, A sub I, A sub B, A sub C, A sub C for chronological age. And that will complicate the model quite a bit, but it's very important to incorporate chronological age. And we have applied this model to New York State, but we want to apply it to many places, any state. And you have to, again, you can't develop a model for the United States, really, in the way that we did for New York State, because it's different in California than it is in New York or Miami or Nashville or wherever you're from. You need to go local typically, and if you really want to understand the differences. And so that's another feature. We want to understand what happens when we change parameters. How could COVID-19 have been reduced in its severity? Well, we could have increased quarantine. We could have began vaccination earlier or at a higher level. There's many ways to take the model with its history of an epidemic, looking back into the past, and change parameters, change ideas to see what would have happened. And that's a way to better understand what to do in the future for the next time. What could we have done to make COVID-19 much less severe? We can take our model that gives a history and we can try to understand what would have happened if we had changed elements in that model. So you can take a mathematical model for epidemic. You can go backward or you can go forward. And both are valuable. If you go forward, you can try to predict what will happen into the future. And that's certainly very important for health officials, policy, and so on. But you can also take a model of an epidemic that ended, and you can go back and try to understand what would have happened if you had changed elements of that model. So we can go forward in time, we can go backward in time, and we can try to understand the next pandemic, which will come. We don't know when, but it will come, and we can try to reduce its severity. And I think the day will come when mathematical models of epidemics will be very well recognized as valuable in understanding how to handle epidemics, terrible pandemics. And as I started at the beginning, nothing has been worse for us than COVID-19. Nothing changed your life more than COVID-19. And so it's so important, and we want to keep working on it And so I thank you all for coming this morning and listening to my presentation. Thank you.